One of the many repercussions of the US election that is sending shockwaves into the system, uncertainty in the health and wellness marketing world. If you're in pharma or healthcare or wellness advertising, buckle up because the landscape is shifting very, very quickly. So what's going on? The promised changes in the US healthcare industry are creating massive turmoil, and it's already trickling down into the ad space. Traditional advertising channels, even social platforms like Facebook, which many brands have leaned on for years, are becoming less reliable, less stable, especially for those in just these broader sensitive categories like health and wellness. And Meta appears to be taking a hard stance. According to multiple marketing news sources and insiders, Meta plans to block brands categorized as health and wellness from using bottom of the funnel events and activation for ad optimization. While Meta hasn't released an official statement, conversations on platforms like Reddit and Threads and even Blue Sky suggest this change is already rolling out far sooner than the rumored 2025 timeline. So here's where it gets tricky. Meta's categorization of health and wellness is so broad. It's catching beauty brands in its net as well, and other kind of vertical and adjacent categories. And if you're serving clients in this space or you're working in this space, you need to start diversifying your channels like yesterday. But here's the good news. This is also an opportunity. If there was ever a time to reclaim control over your content, your data, and audience, the relationships, it's now. Forget relying on third-party platforms. You just can't trust them anymore. We are helping companies in this and other industries build their owned and operated, brand-safe, video and community-powered ecosystems. You can connect and distribute content inside these environments and channels, and they're not really ads. Whether it's as a destination for content and connection or a distribution strategy for brands across a network of destinations, all of it can leverage zero and first-party data via our Genuine's white label platform to create meaningful, direct connections with your audience, whether they're medical professionals, healthcare administrators, or patients. So my advice, if you're doing stuff on Meta, check your categorization immediately, but start exploring new platforms, including your own, and these strategies that will put you back in the driver's seat. The health and wellness ad and marketing space is changing, but the brands that adapt and innovate and focus on ownership and reclaim this destination within their owned and operated ecosystem, I promise you are going to thrive.